According to the National Library of Medicine, hand injuries constitute up to 30% of the total cases treated in the emergency room. On today's show, we will be joined by hand expert to answer your questions and offer your tips on how to manage and resolve injuries to your hand. That's all coming up on this episode of Ask the Doc, No Appointments Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello and welcome to Ask the Doc, No Appointments Needed, the show where the health questions you send in are answered by doctors and medical experts. And thank you so much for joining us today. I'm Kathy Buccio, and I'm very pleased to be joined by Dr. Elizabeth Ouellette, Medical Director of Hand and Vice Chair of Research at Baptist Health Orthopedic Care. Dr. Ouellette, thank you so much for your time today. It's such a pleasure to see you.
Good to see you too. Thank you. Thank you for having me.
Absolutely. We have a lot of questions, so I'm going to jump right in. And the first one is from Andrew, and he asks, I work 9 hours a day at my computer and my hand really hurts at the end of the day. My coworker says I may have carpal tunnel syndrome, but I have no idea what that is. Can you explain more about carpal tunnel syndrome and, more importantly, what I can do to still be able to work? Dr. Ouellette, I have a short video to play, but before I do, please tell Andrew and our viewers what carpal tunnel syndrome actually is.
Carpal tunnel is actually the compression of a nerve as it's running through your wrist. And so it causes your fingers to go numb, can cause your thumb to be weak, everything to swell, and then your whole hand aches. So even if you have arthritis, which is otherwise minimally symptomatic, the carpal tunnel can make it more symptomatic because it makes everything ache.
Thank you for that, Dr. Ouellette. We're going to watch this video on carpal tunnel syndrome, and then we can discuss it further on the other side.
This is the pathway that creates a problem.
And this is basically the carpal tunnel ligament. The median nerve is this yellow structure.
Carpal tunnel syndrome is simply pressure on that nerve. A majority of the times, doctors don't know why, but sometimes it can be due to a mass or thickening of the tissues in the carpal canal.
And patients will generally complain of numbness and tingling. It mainly happens at nighttime.
Orthopedic surgeon Dr. Sanj Kakkar says if symptoms are ignored, carpal tunnel can lead to difficulties doing what were routine tasks.
Women have difficulty doing their bra. Men have difficulty doing the top button on their shirt.
Dr. Kakkar says for some patients, wearing a wrist brace at night can ease symptoms. A steroid injection may help, although the effects can wear off over time. The next option is a short surgery to open the tunnel and relieve the pressure.
All we're doing is literally opening up this band. The actual procedure takes 5 to 10 minutes. And it's amazing the number of times you see patients who say, I didn't realize that's all it took.
For the Mayo Clinic News Network, I'm Jeff Olson.
All right, Doc, that video provides a really good base, but let's dig a little deeper here. So are there preventative strategies or maybe some lifestyle tips, Dr. Ouellette, that you could recommend to Andrew to help reduce the risk and treat the effects, maybe manage the symptoms of carpal tunnel if he does have this?
Yes, there are. So number one, the 4 top causes of carpal tunnel are metabolic. So, if you're overweight or you have diabetes or you have any other kind of inflammatory conditions like rheumatoid arthritis, etc., all those things can affect this. Number 2 are hormones. So women obviously feature heavily in that in the early years up and through menopause, but men pick up on it later in life. And so men from 55 out can have carpal tunnel as well, just because of hormone issues. There are also anatomy issues and there are genetic issues. There's actually a gene for carpal tunnel. So and that's basically for nerve entrapments. So one of the keys for metabolic, as we know, we're all talking about that in the press these days, all what having to do with eating highly refined foods, etc. And I tell my patients, go organic like a heart attack, both in food and in skincare, because anything you put on your skin is 30 seconds across in your bloodstream. So, use the different apps out there for helping you know how toxic a food is or isn't. That will help. But also, again, just reading your labels, trying to minimize the number of chemicals in there, the amount of refined sugar or pre-processed foods that you eat. The more you do it from scratch yourself at home, from local farm produce, et cetera, all those things will help you. And that will help you actually lose weight, even if it's just 10 to 15 pounds. So, for instance, canned drinks. The liner in the can actually turns out to potentiate type 2 diabetes. So try to avoid canned drinks, go glass. You can still have your favorite drinks, but go glass. And so there are just lots of little things like that, that once you start to dig in to health and going organic, you're going to pick up on that. And the other thing on the weight loss side is also no pattern. In other words, you know how we all go on a diet and we all eat the same thing for breakfast, the same thing for lunch, and the same thing for dinner. And for 10 days, we're losing like maniacs. And all of a sudden the door shuts. What was that? Why did the door shut? Because you told your body, Ice Age. And your body now knows it's got to conserve you for 20,000 years in extreme cold, and therefore it shuts down your burn. Don't tell it that. So mix it up. Every day, eat something slightly different, exercise slightly differently. Don't do the same exercise, the same calorie burn every day. Mix it up, and that's going to help you.
I like that. No ice age eating. Thank you, Dr. Ouellette. Okay, our next question comes in from Barbara, and she writes, and I'm shocked that 30% of all ER visits are for hand injuries. I'm curious, what are some of the most common hand injuries and conditions you treat at your facility? I was a little shocked by this one as well when I did my research for the show. I mean, I was going to say the first one is probably avocado slicing a hand injury, but so what are some of the most common hand injuries you treat, Dr. Ouellette, and what are some of the less common injuries?
Right. Just think about it as the hand is your leading edge. That is what you're reaching out to touch the world with. And it is interacting with everything from machinery to doors to windows, glass, the avocado, bagel knife business. Yes. And if your hand slips and then you poke your tendon, now all of a sudden you can't flex that finger, and or you can't feel it because you cut a nerve. So those things all feature in. Be aware of where you're putting your hands and how you're using them. And we don't really think about that much, and which is why these injuries are so high. And that can be the weed eater, messing with a machine, and all of a sudden you find your finger getting caught in a gear, that kind of thing. So crush injuries are some of the most common. And that's, your fingertip crush, where you either get a black and blue nail or you get the finger ripped, and so all those kinds of things figure into that. And with that, when you have those fingertip injuries, don't be surprised that it takes you 1 to 2 years to forget. What do I mean by that? Cold intolerance. That finger, you just ripped a bunch of nerves, you just crushed a bunch of nerves, and they are highly sensitive, and it takes about 2 years to get over cold intolerance. So when you reach in for the frozen peas, you're going to feel this finger up to about 2 years. Don't be surprised by that. It will get better, but it just takes that time.
I got a little squeamish there, Dr. Ouellette, a little squeamish there. Okay, our next question comes from Mike, and he writes, Dr. Ouellette, AI is taking over every part of our lives, so I would imagine it's also playing a role in surgery as well. Can you talk a little about how technology is used in orthopedic surgery and talk about the advances you have seen over the past few years? This is a question I hear in every industry these days, but please, let's talk a little bit about technology, AI, and the advancements especially in orthopedics.
Right. Well, so the way to think about AI is it's just compression of large bits of data. In other words, making associations. So how long did it take us to figure out that carpal tunnel is really associated with metabolic, hormone, anatomy, and genetics? It took us over 30 years, and we're arguing at national level over how much is overuse from typing, an awful lot of lawsuits, disability, etc., caused by that, until we finally had that paper in 2006 that settled the issue. What's causing this? And so you're going to see AI rapidly help us answer those kind of questions. And so AI is going to be wonderful in terms of information. For orthopedic surgery, AI, where's that going to compress things? Well, things like being able to take a picture of a person, and just by the way they stand, you're going to be able to know what their bones look like. And you're going to know an awful lot about them in terms of their bone health, their neurologic health, etc. So we aren't quite at that, but we're all playing with those kind of programs and have been doing so, particularly for therapy, having you imitate motions on the screen, but we're going to be able to tell things about you in that imitation, and that's coming. And now AI is ready. And as we've all had these ideas, we've all had the things that we wanted to fast forward for the last 25 years, but we haven't been able to do it because the tools haven't been there. Now the tools are there. And you're going to see a huge fast forward in knowledge and being able to ask questions and get answers back.
That's fantastic. All right, we still have time to answer your questions, and it's so easy to send them in. Here's what to do.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Thank you again for sending in all your questions. And we actually just got one from Mercedes, this time from our Facebook page. And she writes, my hands are really starting to concern me. I can't open my hands all the way and it's painful. I assume it was arthritis, but my friend told me she has similar issue and I should read up on a condition called I'm going to butcher this. What can you tell me about this condition? Does it sound like what I have? I'm worried that it's only going to get worse. Help. Okay, Dr. Ouellette, what can you tell Mercedes about her issue? And please correct, because I know that's French and I did not sound that out properly.
Dupuytren was the head of the Hospital of God in Paris pre-French Revolution, and he is the original describer of this. And speaking of AI, he only had what he could see. Patients that had this and any associated illnesses that they had, which alcoholism goes along with this. But alcoholism does not cause this. But for the longest time, physicians thought that this was a hallmark of alcoholism, and so people would hide their hands with these contractures. Now, number two with this, the contracture can be occurring at the same time as you are developing hereditary osteoarthritis. So that can be part of it. And so the arthritis can make you ache. But the other thing is the Dupuytren's also causes inflammation in your palm. And so some of this can be trigger fingers combined with the Dupuytren's, combined with the arthritis, and then all three of them make the perfect storm. By the way, AI will help us weed out what are those components and how much is affecting. But the Dupuytren's disease, it's genetic. It has a variable penetrance, meaning it's like a bunch of seeds you throw across the generations. You don't know who's going to pop up with it. And number two, it has a variable expressivity. In other words, you could have the genes, but never express it. You could have the genes and express it severely. And one of the associations that I have found is with oxygen. So if you have low oxygen for whatever reason, because you've got asthma or some other, a lung issue or some heart issue, which is causing not enough oxygen and to be delivered to your tissues, that can trigger the expression of this. So we've begun looking into that at this point. But as far as doing something about it, you don't until you've really got a contracture. And so when that starts to happen, that's when you start to go in to see a hand surgeon. But I would also go in and check and make sure you don't have trigger fingers going on along with the arthritis.
Thank you, Doc. Now, Gabe emails in. This is a really common question. I'm sure that many of our viewers would like to hear that. Does the weather play a role in arthritis pain? I find when it's humid and my arthritis acts up, but when the afternoon rain rolls in, I can really feel it. Am I onto something here? Now, I've heard people say this for years, Dr. Ouellette, and I'm sure you get this as well. So the changing weather, is it because there's a flare up? Is there something to that?
There absolutely is something to that, and that is that your joints are filled with fluid. And the tissue that's making that fluid is synovium. Now, it has pressure sensors that tell it how much fluid to make or not. And barometric pressure, in other words, going up and down, for instance, can you feel a hurricane coming across as the pressure millibars drop? Absolutely. And so it is not at all a myth that people say, oh, my bones are aching, my joints are aching, the weather's changing. That is absolutely true. And then it has to do with the barometric pressure and the kinds of tissues that make the fluid for your joints. And so that's why you feel it.
So not a myth. That is a fact.
Right, not a myth.
Okay, so our next question is from Eric, and he writes, I hurt my thumb while catching a football, and now I can't hold things tight. I was concerned that it's broken, but my friend said it might be skier's finger. What is that, and what is the treatment and prognosis for that type of injury? Okay, Dr. Ouellette, that's a term I'm not too familiar with, so can you explain what skier's finger is?
Well, skier's finger, what also used to be known as gamekeeper's thumb, because the gamekeepers would break the rabbit's neck to kill it once they caught it. And so, and with that, over time, they would loosen up their joint at their thumb. And let's see, there we go. And so with skiers, I always tell people, please don't strap your poles to your hand. So there's different poles. You can strap it around your wrist. There's different poles that you can hold it that lock your hand in. You don't want that. How much does a pair of poles cost? About $150. How much does a thumb surgery cost? About $10,000 to $15,000. It's a no-brainer. Drop the poles, and and you'll be okay. So, but skier's thumb is when that gets pushed, and now you rupture this ligament.
Right.
So it can be a grade 1, it can be a grade 2. A grade 2 is a 50-50, whether you have to fix it or not, and it has to do with your pain, not anything else. And so you've got time, 6 months to a year to make up your mind, oh, I'm going to really have to do this or not. A grade 3 is where your thumb opens out like a gate and just opens right out. And that's because the ligament has flipped above a particular muscle that attaches into that bone. And so now there's no hope of that even scarring down or ever being stable. And if you don't fix it, it goes on to arthritis and causes you a lot of pain. And the operation of choice for arthritis of that joint is to fuse it, to make it stiff. So you really want to fix this if you have a grade 3, a grade 2 if you're still hurting. But number 1, try never to get it in the first place. Lose the poles.
Exactly, lose the poles. Okay, so all right, we still have some time to answer your questions, and it's so easy to send them in. Here's what to do.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back, everyone. Okay, our next question comes from Angel, and she writes, my husband needs a procedure on his hands, and the orthopedic doctor talked about physical therapy for recovery. I'm curious, what role does physical therapy play in a patient's recovery from hand surgery? Angel, good luck to your husband and to you. So I'm wishing him a speedy recovery. Dr. Ouellette, I would imagine that physical therapy plays a very important role in a patient's recovery. Can you elaborate on that?
Yes, it does. So I always tell patients that it's 1/3, 1/3, 1/3 for the outcome. I'm 1/3 of the outcome. Choosing the right diagnosis and choosing the right surgery for you. The therapist is 1/3 of the outcome because they help you know what motions you can do. Don't be hesitant about certain things and do go slowly on others. And so they're aware of the healing and the kinds of motion you should do and how to protect that motion, but still accomplish the functional motion that you need. And then you, the patient, are the final third. How much are you willing to do to make the right things happen? And so when all three of us are aligned, it's a lovely thing to behold. You've got a hand that works.
I love that because it's a team effort on all fronts. Okay, next we hear from Sandy, who emailed in a question a lot of people can relate to. Hi, Sandy. I sit at my computer all day at work, and then at night, I love playing pickleball 3 to 4 nights a week. Is there anything I can do to ease the wear and tear on my hands and wrists, short of quitting my job or not playing pickleball? Dr. Ouellette, I would imagine you're seeing a lot of hand injuries from pickleball, tennis. What would you tell Sandy?
Well, first let's attack the job stuff. And we now know that typing, etc., is not damaging your hands. You might get tired, but it's not damaging you. On the other hand, if you're aching as you're trying to type and do all that, then get a voice-activated program. And work with your business, whatever, to do that so that it minimizes how much typing you have to do. And these days, voice-activated is so common and so prevalent, it shouldn't be an issue. So that's number 1, get your work to settle down. Number 2, don't stop playing pickleball or tennis. Why? Because it diminishes your cognitive decline. The people that play racket sports have the best cognitive ability, and you want to keep that. It also keeps you social. That also helps with cognitive decline. So all these things are important. On the other hand, do you have to be radical on the pickleball court? No. Just enjoy it for what it is. You don't have to go hog wild and, leaping for a ball kind of thing, because you don't want to fall. And no matter what any of us are doing, including medications, etc., can we totally restore our bone density back to what it was at age 21? And now I'm using women as the example. No, because at age 21, you're now going on the decline. And your bone is as good as it is. So the way to think about it is like your bone is a Swiss bank account of calcium. And that Swiss bank account is as much money, calcium, as it's going to have in it when you're 21. From that point on, it's maintaining what you have. Now, pickleball is going to help you do that. Just don't be a wild person, but continue to enjoy the sport and enjoy the people in it, and just be calm about it. Okay, that's hard to say because that's the whole point is competition, right? But not really. The whole point is to understand the physics of the game, enjoy it, and enjoy the people playing with it. So do that.
No Serena Williams level of pickleball, right, Dr.
No,
Ouellette?
you don't have to be Serena.
We don't have to be Serena. Okay. Our next one is from Oswald, who asks, what advice would you give to someone hesitant about hand surgery or concerned about recovery? Now, I know that a lot of people are always hesitant to get surgery, especially when it comes to their hands. So what advice would you have for Oswald?
Well, number one, much of hand surgery is not urgent emergent.
Okay.
There's only 3 situations, and trust me, you understand what they are. It's arm or finger off. Okay, nobody has any trouble understanding that. It's now. Compartment syndromes, which are extremely painful, and you're going, why aren't you in the operating room doing something about this? So you know that. And necrotizing fasciitis or gas gangrene, which is a kind of infection, which is very painful. And trust me, you all know now. So those are the only 3 times you absolutely have to go to the operating room emergent. Everything else is we've got time. And so then the question is it elective? If it's elective and you wait, so let's say it's a ligament tear, like we just talked about skier's thumb, and let's say that's a grade 3, you don't want to wait on that. But do you have to go this week? No, you could go anytime in the next couple of months and make it fit your life. And so that's one of the things that I tell people, make it fit your life. Why? Because if you're 1/3 the outcome, I need you in on this. I
Absolutely.
need you giving time that you can devote to this to make it go right. So that's number one. If it's elective kinds of things, let's say about arthritis at the base of the thumb, you have all the time in the world. And it's the same operation now as 5 years, as 10 years from now. So there's no howling hurry to have to go to the operating room. On the other hand, carpal tunnel, you'll get into some arguments on, well, you got to go now because it's going to permanently damage your nerve, et cetera, et cetera. I'm here to tell you, it took me 7 years before I released my carpal tunnels. You have time. And so make it fit your life. Because if you make it anxious and emergent when it really wasn't, then you will set yourself back. Don't do that to yourself. So I always tell patients, you have time. This is in your hands. If we fill out an operative consent and agree, well, this is the surgery we want to do, but life gets in your way and you don't get it done in the first 6 months after we've decided to do that, because the ticket gets written to do the surgery and the ticket expires at 6 months. Fine, we just see you again in clinic and rewrite the ticket. Don't worry. Don't worry. Don't make this an anxious affair.
Thank you, Dr. Ouellette. Okay, we have time for one more question. So this one comes from Justin. I'm 38 and have been dealing with arthritis. However, I keep going to the gym because I feel like I can deal with the pain. Can I make it worse by working out, or can I keep going as long as I can tolerate the pain? Okay, Dr. Ouellette, what do you say to Justin? 30 seconds.
Okay, if you are ligaminously lax, no flies, no things out and away from the body. Keep it centered in the body. Keep supporting your joints, and don't make your muscles and your joints have to stabilize you. only your muscles. You only want to strengthen your muscles. So something along the philosophy of Pilates and in the core. If you will stick to in the core, you will keep yourself safe.
Amazing. Thank you, Dr. Ouellette. Okay, that's all the time we have for today. And actually, I hope we get to do this again because there's so many more questions. Thank you so much for your time, your incredible insight, Dr. Ouellette. And thank you to all for joining us and sending in all those wonderful questions, very important questions. I'm Kathy Buccio. We'll see you next time on Ask the Doc. No appointment needed. Stay safe and be well.
Thank you.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.